Hello, happy Thursday. I'm so happy to be here today talking about one of my most favorite topics to talk about. It's documentation. I actually have a lot to say about documentation. Don't get me wrong. I do hate it, but I love talking about it. I love teaching students and new grads about how to be efficient and effective with their documentation. So today I'll be sharing top tips um, for skilled and efficient documentation. I will be explaining some key things to avoid with documentation, and I will be reviewing the 8-minute rule for ethical and legal guidance. My goal here is to help you be more efficient with your documentation, be able to write notes that are sure to not end in insurance denials. I know documentation sucks. I completely agree with you, but we have to do it. It's how we get paid. It protects us if anything ever goes awry, like a patient or family decides to sue us for something. And it helps any clinician that's following you to know exactly what you did the last session and how to move forward with your patient. So, my goal for today is to help you discover some new ways to be efficient with your documentation while still showing the skill that you provided. So, for anybody new here, I am Dr. Jody Miller. I'm a physical therapist and a mentor to PT students and new grads. I've worked in just about every setting that you can think of, everything from acute care, oncology, pediatrics, a lot of outpatient. Most of my career was in skilled nursing. I've been a rehab director, I've done adjunct teaching, lab assisting. I own my own cash-based practice where I work with gymnasts and cheerleaders, and I'm also the owner of Clinical Connections Mentoring, which is where you are right now. If you'd like, please tell me if you're watching live, just drop live in the comments. Tell me who you are, where you're from. If you're watching the replay, same thing, just drop replay. Tell me who you are, where you're from. I just like to know who I'm talking to. So let's get started with reviewing what skilled documentation means. So the most important information that you have in the note is the skill that you provided and what you did during that session with specifics. This is what insurance companies are looking for to approve or deny reimbursement. This is how we get paid. The skill typically can go into the objective section or the assessment section. I always say it doesn't matter where it is in the note as long as it's just in the note. Sometimes it can make more sense to go in the objective part, where you're describing what you did during the task. Sometimes it makes more sense to go in the assessment when you're describing how you use skill to tell the story of the patient, whether that's the story of why they're there for an eval, or it's the story of how the session went, or it's the story of how they're progressing over time. So it just put it where it makes sense, right? In the objective section, you can include skills that you provided during the specific intervention. So you can include things like verbal and tactile cues, measuring vitals during a task, assessing their RPE during a task, facilitating movement patterns during transfers or gait. It is much easier to document the skilled services you provided in the objective section because you're writing exactly what you did in order to help that patient. In the assessment section, you can include skill to tell the story or show the patient's progress, right? So, patient needed less verbal cues this session. Patient's oxygen dropped to 90%, so the patient was instructed in deep breathing techniques. Patient showed less fatigue, so reps were increased to 15 reps today. It's harder to show skill here in the assessment, but you can show medical necessity here as you explain how the patient responded to something, how they're progressing through sessions, and the need to continue with therapy. So those are just some examples of where you could how you would write it if you're going to put the skill in the objective part, or how you would write it if you're going to put the skill in the assessment. Really, it just matters that the skill is in the note. Okay, now let's keep talking about skill and how to document it efficiently. So remember, the skill is the most important part because this is what insurance companies are looking for. This is where clinicians can get tripped up or where documentation tends to take a little bit longer. And this is because we know that this is the hard part to document. We know that we are skilled providers, but putting that onto paper is what the hard part is. So when you think of skill, here are some words that you can use. Things like analyze, assess, direct, downgrade or upgrade. Educate is a good one. Modify, progress, teach, cued, assisted, facilitated, measured, right? Those are examples of skilled words. The following are unskilled words. So things like supervise, just watching someone do a task is there's no skill in that. You're just watch. So supervise is not skilled. Observe, monitor, maintain. These aren't showing any progress. They're not showing that you're doing anything. Practice is another one that's not skilled. Having someone practice something, there's no skill to that. You're not doing anything, okay? So you want to avoid those words because they don't really show that you did anything for that patient. There's absolutely no skill in those words. So one of the reasons documentation can take so long is because we need to be specific and detailed when we're writing what we did, right? For two reasons. One, we need to make sure that anyone coming behind us can pick up where we left off. If you call in sick, the person covering from you should be able to know exactly what you did and what your plan is for the next patient. And it also protects us in the future. If someone decides to sue you, you want to be able to remember exactly what you did and what happened with the patient that day, and clear documentation can help you do that. Okay. But detailed documentation doesn't have to be an essay, right? So let's look at an example. Let's say it's written this way. Patient ambulated 200 feet in the hospital hallway with a hemi walker with min assist at the gait belt and the shoulder to maintain the patient's balance and to prevent loss of balance with minimal assistance to advance the left lower extremity and to increase hip and knee flexion during swing phase 25% of the time and facilitation at the left pelvis during stance phase to increase stability as the patient advanced the right lower extremity. That's a lot, right? I got tired just reading it, right? And saying it, okay? That's a lot. You do not have to have that, all of that information. So let's see how we can shorten that into something a little bit better. Patient ambulated 200 feet with the hemi walker with min assist for balance and to advance the left lower extremity during swing phase 25% of the time. Patient also given facilitation at the left pelvis for stability during stance phase. So it's much shorter, but it still includes all the skill provided, and you can easily replicate this intervention, right? The skill is clear in the amount of assistance that was provided, what it was provided for, and how much was provided. It's also reproducible because we know how far they went. The objective information is in there. What assistive device was used, what the therapist did, and why. So remember, it doesn't have to be an essay. It can be shorter and still include a lot of skill. So let's go the other way. Let's look at an example that doesn't have any skill and is not reproducible. So this is very common. You see something like patient performed rows with a TheraBand for strengthening. Well, this doesn't tell me anything. If I were to come in behind this therapist, I wouldn't know how much, right? What position were they doing the row? What side were they doing the row? How much, what color band, how much resistance, how many reps, whatever, what was done, right? So let's fix it. Patient performed standing bilateral bent arm rows at 90 degrees abduction with a red TheraBand, 3 sets of 12 with verbal cues for scapular retraction and to keep their shoulders down. So it shows skill with the cues. It's reproducible because you know exactly what was done. You can actually picture the person doing this task. It's also not a novel. It shows detail, but it's not too wordy and it doesn't take forever to write. Okay. So now let's talk about some shortcuts that can help with this. The first one is to document at point of service. And I understand this is easier said than done, but it can be done. Okay. The subjective is the easiest to do this with. So simply tell your patient, hey, I'm going to be typing this while you're telling me how you're feeling today. Okay. Just give them a heads up that you're going to be typing it while they're talking to you. Can be true for evals and daily notes. So whatever they're telling you, put it right into the note while they're telling you. For evals, you can quickly type in a measurement right after you assess it, right? If you're in an EMR, the box is already there. So you measure knee flexion range of motion, go ahead and put it in right away. It's way better than memorizing, trying to remember everything, right? You can also quickly type Therex as a patient is doing it. So you don't have to watch every single rep of every single exercise you give a patient. So sometimes while they're completing that last set, you've already given them the cues. They already have a feel for how to do it properly. During that last set, quickly type in that exercise with the skill that you provided. Remember, it doesn't have to be very long, so you should be able to quickly put it in while they're doing another set of 10. Okay, if you're a student, practice this now. So practice by documenting while your CI is doing an evaluation or a treatment session. Document when and what you would if you were the person treating that patient, right? So you're watching your CI and they're doing something. Figure out when would be a good time to pause and drop something into that note. That's when you're going to write it while you're watching your CI do it. Okay, practicing it now is going to help you get used to when it's your turn to treat and document every patient. Okay. Which takes me to my next shortcut is to use smart phrases in your EMR. So these are predefined standardized text that you can drop into your documentation by typing a short command. Okay. You define a template of the text, okay? So it can be used for common manual therapy techniques that you use. It can be a statement that you commonly use for Therax. It can be an assessment phrase that you commonly use to address skill, right? Then you assign it a unique code like backslash TXREPS. Then, when you type in that code to the EMR, the system expands it to the full text and you just simply fill in the blanks. Right. This saves time because you aren't repeatedly typing the same thing over and over again for every patient. And it already includes the phrases you need to show skill for reimbursement. Okay. So all those things that I mentioned earlier, especially those key words that show skill, put those right into your smart phrase, then just fill in what you did with the patient during that session. The skill will already show up. Okay. So let's give you an example. So a smart phrase could just be dot Therax. When you put that in, what it expands to is therapeutic exercise performed blank exercise, blank sets, blank reps with blank load, right? You just fill in the blanks, provided manual cues to address blank, whatever compensation they were, for correct technique without compensation. Patient was able to correct blank percent of the time. Shows exactly what you did, shows the skill. Okay. And all you had to write in was dot Therax and then fill in the blanks. Another example would be like dot gait. So that can expand to gait training, patient ambulated blank distance with assisted device, whatever assisted device with blank level of assist for balance and stability. Provided manual cues to address whatever compensation and decrease gait deviations. Okay. So assessments tend to be the longest part of the documentation, but you can create smart phrases for your assessments as well. And doing this is going to shorten the time that you spend documenting. Okay, so use the smart phrases. So now I want to talk about some common documentation problems and pitfalls that you want to avoid. So these are the red flags for insurance companies. These are the things that they are looking for to deny payment. Okay. Do not do parrot documentation. So this is saying the same thing every visit, literally copying and pasting from the last session. Nothing changes from one session to another. Do not do that. There has to be some change from one session to the next. Don't use undefined abbreviations. So don't make up abbreviations. Only use abbreviations that have been approved. This can be tempting to make abbreviations to make documentation quicker, but don't do it. Just use those phrases, right? Don't provide lack of substance, just like the example that I provided earlier. You got to have something in there showing what you did and be specific in what you did. Use specific phrases. So, a very common one that you see all the time is patient tolerated treatment well, right? You've probably seen it a lot. Um, you may have even written it yourself in an assessment, but this says nothing about how the session went. Just leave it out, right? Instead of writing patient tolerated treatment well, just don't put it there. Instead, just write what actually happened, even if they did do well. So, an example could be patient able to tolerate more reps today with fewer rest breaks and their oxygen stayed above 98%. That gives me a lot more information about what happened. It tells a much better story of that patient and that treatment session than patient tolerated treatment well. So insurance companies are looking, if you write patient tolerated treatment well, they see that, they're going to red flag it and they're looking to deny your payment. Also, don't use continue POC. This is another super common phrase that people like to put in the plan. Again, this doesn't give me anything. Doesn't get, if I'm not there tomorrow, it doesn't give the following therapist any guidance on what to do. So write out what you want to do specifically in the next session. Increase all upper extremity exercises to 15 reps, increase gait distance to 500 feet, trial the wide base quad cane for transfers, add standing exercise. So it doesn't have to be super specific, but give some guidance on what you plan to do the next session. Don't use continue POC. Okay. Last, let's review the 8-minute rule. So the key here is to remember that if the insurance company reimburses based on the Medicare 8-minute rule, it's the total time that you spent on timed codes that matters here. Once you know the total time, then you use that 8 minute rule chart. Okay. So for if you do 8 to 22 minutes, that's 1 unit. If you do 23 to 37 minutes, that's 2 units. If you do 38 to 52 minutes, that's three. And 53 to 67 minutes is 4 units. So if you spent 25 minutes with a patient, you can bill 2 units. Remember, it's the total time that you spent with that patient. If you spent 21 minutes with a patient, you can only bill 1 unit. It's always the total time that you spent with the patient on timed codes, not how much you spent on each CPT code that determines how much you can bill. Okay. An example is, let's say you do 8 minutes of gait training, 8 minutes of Therex, 8 minutes of therapeutic activity. A common mistake is that clinicians assume that they can bill 1 unit for each code because they spent 8 minutes on each code, but it has to be determined by the total time that you spent with that patient, which in that case is 24 minutes, which is only 2 units. Then you get to decide which 2 units you want to bill. Okay. Also remember, this is just for time-based codes that you provided during the treatment session. So if you provided any untimed codes during the session, those codes get an additional unit. So an example would be, let's say you did 16 minutes of manual therapy, 32 minutes of Therex, 8 minutes of gait, and 15 minutes of unattended e-stim. First, you take the total of the timed codes, which is 56 minutes, which is 4 units. But you also get to add one other unit because you did unattended e-stim, which is an untimed code for. So for that patient, you would actually get to bill 5 units. Okay. So to review, you need to include skill in your documentation. It is easier to do in the objective portion, but you can also show skill and medical necessity in the assessment portion of your notes. Avoid words like observe and practice and supervise. These don't show that you did anything skilled. Be specific when you're writing what you did, but be brief and use those smart phrases to do that. It is much quicker and it prompts you to add the skill to the phrase, or you already have the skill in there. Okay. Document as best you can when the patient is there with you. Do as much of that as you can. And remember the basics of that 8 minute rule so that you can make sure you're following the legal and ethical rules of billing. I hope these tips and tricks will be helpful for you. If you are a student, you're new to documentation, make these kind of your documentation habits now. If you've been documenting for a while, I know it's hard, but try to make some of these new habits, and documentation will get much easier, much more efficient, much more effective for you. I hope you learned something new. Please go ahead and drop in your comments your aha moment, something that really stood out for you or something new that you learned. I want to thank you for coming to my little corner of the internet, watching, whether you're on Instagram, hi, whether you're watching on Facebook or whether you're watching on YouTube. If you have any questions about what I talked about today, please feel free to message me. Leave your questions in the comments. I will definitely come back and answer, and I will see you next time.